All righty. Welcome, everybody. It is so good to have you here. Thank you so much for joining us. And let me just get the of some of these things up and running. So thank you so much. What I would love for you to do is go ahead and put in the chat who you are, where you're from, and what kind of healthcare professional you are. And that would really help me out. First of all, it would let me know that you can hear me, that you can see me, and I'll put my slides up in a minute and we will get going. So thank you so much. We have got so many hundreds of you on, so it's going to be a wild one tonight. So thank you so much. Wow, there are a lot of names here. Thank you so much. I'm only going to get them on the fly, so I may not get your name exactly here. Wow, there is a lot here. So Kate from Cleveland, Ohio, who I think is now rendering an NP, Katja, an NP from Seattle, Danita from Kentucky, and let's see. I mean, there are a lot of names here. What am I supposed to do? Thank you so much. Other than thank you all for being on here. David, who's a DMD, who's a dentist from Chicago, and Shahid and Amelia and so many of you. Thank you so much for being on. I wish I could get to all of you. And Jennifer, who is an MD from Texas. I mean, you see, we have got every single healthcare professional that can inject on here. So thank you for joining us. We're going to get to this. Feel free to ask questions at any time. I know you can see me. I know you can hear me, but thank you from my heart to yours for sharing the time with us. And I want this to be your program. So feel free to go ahead and ask questions. I'm going to ask you some questions as well. Let me share my slides so we can get going. And let me go to full screen on my slides. And then let me put everything where it should be. Tell me that you can see my slide. That would be helpful there too. And again, we're on the multiple platforms here, but if you are on the webinar platform, which is always going to be the best experience, then that's where you can be on. And this is going to be, we're going to be at full, we're going to be at full capacity on the webinar in just a minute. So make sure you log on if you're on any other kind of any other platform. All right, let's get into this. The 3 best lip filler technique for 20-year-olds, and we'll talk about why we're keying in on 20-year-olds here. But the quick introductions, as always, for those of you who don't know, I know we've got a lot of new people on here. I know that we have got a lot of AAFE members or people that have taken AAFE courses. Let me just get everything working here. My name is Dr. Louis Maltzmacher. I'm president of the American Academy of Facial Aesthetics, and I am very open. There's my email right there. Take a picture of it. Take a picture of the slide because we're going to steer you to some of the different websites that are on these slides, but this is always a really good resource. American Academy of Facial Aesthetics, there's their email as well, aafespecial.com, tuition specials, and a lot more as we go through here. So thank you all for being on, and this is from one of our live patient training courses that we have all the time because that's what we are here. But let's start off with you. Tell me about yourself here. Many of you have never injected before, so you may have taken some AAFE webinars before just to get your feet wet. See if this is for you. Many of you have injected. You've taken maybe a level 1, and many of you may be experienced injectors. What do you want out of life? Why are you even looking at facial aesthetics here? So what are the steps to achieve your dreams? So put it in the chat real quick, or again, on any platform you're at, just the number here, or numbers. There's no one answer here. Tell me about this. Will tell me a little bit about you for that. Do you want to be number 1 med spa and aesthetic practice owner? You want to achieve financial freedom? Who doesn't want that, I guess? Gain more free time, free autonomy, enjoy autonomy and choices, work in a med spa or an aesthetic practice, own a med spa, that's the number 1. Become a trainer. You want to get into that. Serve as an example to others, for your kids, for your siblings, for your parents, for whatever, for any of those kinds of things. And again, doesn't matter what kind of healthcare professional you are. If you're a physician, if you're a dentist, you may have a practice already and you want a sub-practice or just want to get this into this. Achieve financial freedom seems to be a lot. Gain more free time. You're really in charge of your time for this. Enjoy autonomy and choices. Again, if you're in medicine or dentistry, this really gives you a lot of choices because no matter what you are, you have the ability to achieve that financial freedom. freedom, which you may not have if you're in other parts of medicine, dentistry, nursing, and that kind of stuff. So you can see for yourself, those of you who are on the webinar platform here for that. I mean, 1 is pretty popular. Some of you want 5 working in med spa, but 2, 3, and 4 certainly to be super popular. A few of you want to be trainers. You got to work your way up. The AAFE has a mentoring program to become an AAFE trainer, and so it's really all the above. And many of you wrote it all the above. So that's good. That tells me a lot about you and what you're trying to achieve. And we're going to help you get there, certainly, but we're going to focus in on this one thing. But the key here is lips, and we're going to go into lip filler techniques and show you some pretty detailed video presentations, but it's also about the 20-year-olds, which we'll talk about in a little bit. But let me give a quick introduction about the AAFE because we do have so many new people on here. Good refresher for those of you who may or may not or think that you know the AAFE. There's there too. Over 20,000 healthcare professionals trained. I think it's more like 22,000 at this point. We regularly consult with medical, dental, nursing, licensing boards. We collaborate with all the different associations, give courses with many of them as well. New injectables and technique development. We are very much on the forefront of what is new for that. And we have full-time faculty. We're the only organization, educational organization in injectables that has full-time faculty to help attendees. They also see patients as well, but they are there to help you. We have the most robust post-course support, like real post-course support, which you're really not going to find anywhere else. That's what you get when you go with the AAFE for training here. And our live patient training, we have the most trusted aesthetic educators here. We call our courses Ready to Inject because you will leave ready to inject. We're going to make sure of it. And you can be injecting paying patients in as little as 14 days after a course. Many times in 7 days, you can go seriously right to it. That all depends on you. But the difference with the AAFE is we're going to really push you to go ahead and get started because we know as trainers, and I've been training different healthcare professionals on a lot of different techniques and clinical developments for over 40 years. I know that the second you leave a course that you've been trained on something, if you don't get right to it in your practice, you will forget about it. You won't remember, how to really do it well. You'll think about it 6 months later. Yeah. And then you got to kind of try to relearn it for that. We are going to push you. We have an entire team that is going to push you to try to get started, but it's really up to you as soon as possible because we know that makes the most successful injectors, practitioners, practices. I mean, we certainly know that from all of our surveys of, in terms of what you can add to your practice. I mean, practices that we train that people really get into it right away are adding between $30,000 to $50,000 a month onto existing practices and building that up if you're going to go to your own practice. So that is very, very doable. Many of them do much more. It just depends on your effort, and we can really help you get there. But you're going to learn from real life injectors. Bring patients or find one at our courses. We prefer if you bring one because that's how you learn is when you take them home and see what happens with them. One-to-one instruction, accredited courses, but the post-course support is a big deal. We make a big deal out of it. You know why? Because it's the biggest deal. How many times have you left a course and there's no one to talk to, right? I mean, there's just no one to talk to. We are going to make you successful. That's what we're really, really known for that. And one of our biggest philosophies is this. The patient is not buying Botox as an example for this. A lot of different things that you're going to offer when you offer facial aesthetics. They are buying you. We don't make Botox injectors. Anybody, there are lots of Botox injectors. Don't be a product injector. Be the best injector that you can be. And that's really what we're all about for all of that. So make sure you follow us on social media, all the different social media channels where we post clinical video nearly every day. We have the best instructors and faculty in the world. They are all real life practitioners just like you. You're seeing a whole mix of physicians, dentists, nurses, nurse practitioners, PAs, orthodontists, endodontists, cardiologists. I'm just trying to look around at this crowd here. Plastic surgeons. They've come from every specialty. Which is really incredible. And now they're all doing full-time aesthetics there, and they are an incredible array of people. Really the best people. They're the best people in the world, but they love to teach, and that's really what's really important for that. But they all have practices in their own. You'll learn a lot from hopefully from me and from these people there as well. Where do we give our courses? All over the country, in the US and a few international places as well. AAFEspecial.com is where I'm going to point you to tonight's special. The AAFE always gives a special here. This is the special. I'll walk you through it for 1 minute, and then we are going to get to our topic, because this is only the second time they're ever running this. They ran this about 3 weeks ago. Very successful. 20 packages available, or until midnight tonight, whatever goes first. The last time they offered it, the 20 packages went really rapidly for that. You can pick any 2 live patient certification training courses. If you're just getting started, a level 1 Botox, level 1 fillers is typically what people pick, and you are going to get all these bonuses. The total package value is $13,250. Number 1 bonus, because it goes to exactly our topic tonight, Master Lips online certification course. Even if you're just getting started, or you can use those 2 live patient certification courses for our level 2 advanced, our level 3 master courses on Botox and fillers, or any of other courses. I'll show you that in just a minute. Or for cadaver and ultrasound, if you're really more advanced for that. But you're going to get the Master Lips online certification training worth $997. You are going to go ahead and get up to $750 of injectables to be used at the courses. You are going to get our Med Spa Aesthetic Practice Business On Demand course, and that's really important. It's going to take you through all the different things about building a successful practice. Even if you are, if you're an employee or want to be an employee, it's got a whole section on consultations and motivating patients to treatment. If you're going to be an owner, it's going to talk about the legal. It's going to talk about a lot of different things in terms of what you need to do, hiring the best employees, all those kinds of things. You're going to get access to our exclusive member forums and post-course support. That's worth $997. 1 team member per course, worth $750. 12 months of AAFE membership, worth $597. You get the idea. When you total it all up, our member office locator, we get so many patients, consumers, every single month, every single week, coming to the AAFE website. It's very well known among consumers, which is why you also get to use the AAFE logo in your practice. All the office forms that you need, worth $597, discounts, marketing materials, all those different things. So that is a great value. These are some of the live patient training courses that we give. So just grab the package. Then the AAFE will help you get your location. They'll contact you tomorrow. And the AAFE's telling me already about 5 of them are gone. So this is good. These are all live patient in-person training. There are 2 parts. First part is going to be didactic. That's all virtual and on demand. When you come in person, you are coming to live patient training, but you have to have taken all of your didactic and treatment demonstrations, everything else. You will be really well prepared, and we're going to make sure of it, because we don't let you come. This is serious training. If you're not going to be serious about it, it's not for you. Don't waste your money. I tell that to everybody. But we want you to be the best injector. That's what we really are all about. So we've got all these courses and a lot more. Again, if you're getting started, level 1 Botox, level 1 fillers. Some of you are dentists. If you want to do level 1 Botox and level 1 TMJ, oral facial pain trigger point, that's a good combination. I'm sure they will add on courses for you depending on what it is. Level 2 Botox is super popular. Level 2 fillers. I mean, they're all really popular trainings for that. So this is the whole list of courses. Go to that QR code or go to AAFEspecial.com, and that is going to take you there. But again, you're not going to see this again. This is a huge value for $32.97, way less than you've ever paid in your life for many other trainings or advanced trainings, because I know what they cost, because I've taken a lot of them there as well. The ROI, and it's really just, it's maybe 2 cases of Botox, 2 cases of fillers, maybe a couple more than that. After 5 cases, you have paid back your tuition, and now you have these skills for the rest of your career, and that's what you want. And you have the AAFE backing you up for that. The Master Lip Online Certification course, included in this package, by the way, has all these different techniques. There are a lot of ways to do lips, and we're going to show you a couple ways in this program here. A lot of ways to go ahead and do lips. All of these are covered and a lot more. So you will really be, again, even if you're just getting started, this is going to be really valuable to you. Certainly, if you're taking more advanced courses, you want to give lips a lot of different ones. You want to be known as the best lip injector around there. Why? It's the first filler service that most patients get, especially in their 20s. We'll talk about why 20s is so important. And that's what's coming up, certainly, for all that. So there it is again. Again, these are going pretty fast. So if you want it, go register right now, aafespecial.com, and grab it. I mean, it's good. AAFE will contact you right away tomorrow for that. Now, I'll come back and answer more questions. There typically will be a lot of questions about training. I'll come back and do that. I will just tell you this as well. This is in a couple of weeks. This is in 2 weeks. We are having, and this is a real training as well, AAFE 911, Filler Emergency Protocol to Reverse Vascular Occlusion and Necrosis Fast. You can go to that QR code. You can go to aafewebinars.com to sign up. This is a heavily discounted till midnight tonight, and then it goes up. We're going to show you video demonstrations of how we reversed a real vascular occlusion and tissue necrosis, and do it fast because otherwise they lose the tissue from injection to complete healing. We're going to show you this step by step. We're going to give you the forms that we use, which typically the AAFE charges $199 for. There's a 14-day replay on this one in 2 weeks so that you can really go ahead and study it and go over it. But it's going to go over the critical steps you have to take immediately, pre-op and post-op medications to stop complications before they escalate, why flooding with hyaluronidase is the worst thing you can do, and a whole lot more. So if you want this is in 2 weeks. This is a live virtual training on how to reverse vascular occlusion and necrosis fast, and you've got to know this if you are ever going to inject fillers. And that's the patient you're going to see. She went from bad to worse really fast. So how do you solve that into where today she is completely healed? That's exactly what we're going to go ahead and teach you. So this is going to be real life stuff for that. All right, let us get to our topic tonight. And first of all, I will say it's a dream practice with injectables. When you go with facial aesthetics and really learning injectables, it's a recurring revenue center in your practice. Botox and all the neurotoxins last 3 to 4 months, then they come back and they get it again. That's almost unheard of, and they pay for it. No insurance nonsense that you have to deal with. It's the happiest part of your practice. It literally is a dream practice that you can build and get paid what you're really worth. And I think one of the most important things that, because we train all different kinds of healthcare professionals, any healthcare professional can be the best injector, there. You can have an RN after your name, a PA. You can have a dental hygienist after your name, an RDH, because in some states, dental hygienists can give Botox and fillers. You can have a DDS, DMD, DO, MD, PA, NP. You can be whatever you want to be. You can be the best injector. Don't think for a minute, I'm not knocking anybody, that plastic surgeons and derms are the best injectors. We know. We train everybody. It's whoever puts the most effort into it. So it's really a very level playing field for that. And we will help you be the best injector that's out there. There's no capital investment. You don't buy a piece of equipment. There's no huge inventory you have to stock. Everything comes next day or 2 days for that. And ask your family and friends if you should offer Botox and fillers. But here's the big point. 2 big points are the bottom 2 parts here. Gen Z and millennials now make up to 35%. It's really closer to 40 at this point of injectable patients. Just saw the latest some of the latest stats just yesterday there. And AAFE members in 2025 are up 30 to 48%. So stop thinking about this, and it's time to do it. We're actually coming into the busiest time of the year, which is always the fourth quarter and holiday season and all those different things. So that's what's so important about Gen Z, and that's why we focus on Gen Z. And I am amazed at all of these Gen Z patients that come in, because when I started giving Botox and fillers years ago, 30 years old was the young patient, 35. Most of them was 40 years old and up. And they were, I don't want to say embarrassed, but they weren't, they were not embarrassed, but they were hiding the fact, trying to hide the fact that they get these things. Now, they don't hide it, they talk about it. And here's exactly what I mean. Watch this little video. Here we go.
So I'm about to get half a syringe of lip filler. This is my before. I've never gotten anything done. I'm so nervous. But I just got paid and half a syringe is only like 300 at this place. So before small and that for 4 months. This feels so weird. I'm gonna move for 20 minutes. This is so embarrassing. I keep drooling. My phone died on the way back, but that is the best decision I think I've ever made. I loved it. Oh my gosh. So everyone said that it was super painful, and y'all, like when it would go in, I wouldn't even feel it until it was coming out, and I would just be looking down, like seeing the needle like in my lips. Like it did not hurt at all. I numbed for like 30 minutes total though. It kind of hurts to go like to try to, rub my lips together. That hurts right now, but other than that, they're swollen right now, so they'll go down, but like I don't want them to. I love them.
That's the big deal between now and then. I mean, now they're talking about it. They put it on social media. She's got 1 million followers. Again, I don't remember how many followers she has specifically, but I'll show you some of the influencers that have 1 million, 3 million followers that are all over social media. And by the way, this is all the information most people that are Gen Z need to know. Hey, they look great, didn't hurt that much, no big deal. The downside is half a syringe, forget the half a syringe baloney. That's going to come back to hurt you. But so don't offer a half syringe, but we can talk about that later if you ask about that here. But let's get to techniques here a little bit. And first of all, anatomy. What do we do in the AAFE? This is how we train. And this is all about precision. You will have very few people that will really train about technique and precision, but it's about anatomy, safety, and technique. That's how you become a great injector, and that boils down to really being about precision here, and that is super, super important for that. Anatomy dissection slide coming up. Again, we're not going we could spend 2 hours just on anatomy, but if anybody that doesn't like to see anatomy dissections, they're not going to want to see this next slide. So here it is for that. Here is around the mouth. This is the corner of their mouth right here. For that, you've got to know this anatomy. This is not an anatomy lecture. We're going to focus much more on technique. But when we train in the AAFE, we are anatomy crazy. That's what we really are. You've got to know the depth of these things. Many times we'll use an ultrasound if you're a little bit more advanced. You've got to know where is that facial artery, how does it split to the superior labial artery, to the inferior labial artery, to the angular artery, where are these things going? Because we are using a jelly material that we do not want to put into these arteries and veins. And it's no different than any other part of medicine or dentistry or nursing where you've got to know depths, you've got to know the anatomy, you've got to know exactly where to stay away from, but you also don't want to put a lot of filler, which is a thicker gel, onto these things because they can compress these arteries and restrict some of the blood flow, which is not as bad, but if you put enough there, it could mimic a vascular occlusion for that. Again, these are rare. When you're trained really well and you're trained based on anatomy, then these things don't happen. They'll happen to probably everybody at some point, but they happen to tend, I mean, again, these are really rare. We don't get these things very often, if at all. And then you have to know how to really take care of complications there as well. But lips have to be a little bit easier because many times you can see if there is a superficial artery that is, you can actually see it kind of like, pumping a little bit for that. And that's easy to stay away from. So if you learn good technique, if you learn anatomy, these are very, very safe procedures for that. I can't remember the last time we had any kind of an event. But if we do, we know how to handle it. And even in courses, which we give every week, and we train hundreds of people every single week, it's rare that we have that. Now, you will get bruising. We'll show you some of that a little bit later on. But here are the 3 best lip filler clinical considerations for 20-year-olds, even though there are 5 things things here, but nobody wants to be a no Botox Barbie when they get older. They all want to be young forever. And when they're 20, they think that they can be young forever. And you know what? They're staying younger for a long time. By the way, think about this. The fact that a 20-year-old is getting these things means that they're going to get these things, I mean, forever. I mean, they are going to be the longest term patients that we have ever had in aesthetics. I mean, I will tell you this. I can tell you from my grandchildren, and we've got a good number of grandchildren here. And you know, the young ladies who are 12, 13, 14, 15 years old are very comfortable in Sephora. Like I am shocked. I don't know the brand names that they're talking about. Banana, elephant. I don't know. I don't know if I'm making it up or it's sticking in my head because they told me it's something like that. For that, they are so into this stuff already. It's no surprise by the time they get to 18, 19 years old. We have had parents go ahead and buy gift certificates for their 20 and 21-year-olds to get lip filler. That's the world these days. God bless where we're at. I mean, it's just really, really incredible for that. But what are the biggest considerations? Proper evaluation and consultation. Give Gen Z what they want. Interesting, you'll see this in some of the videos. Some of them want big lips. That's not as common as much anymore. They want more natural. She was talking more natural, which may look big to you, but in context, as long as it fits her face, they can be good sized lips or they can be a little more subtle. It really doesn't matter. Picking the right filler and choosing the right technique and precision, precision, precision. You're going to see this in the videos. So, I mean, I'd rather show it to you than you know, I can talk for hours on it, but it's easier to just go ahead and show it to you. Available dermal fillers that are out on the market. There are a lot of them. And by the way, they're all great. There are even more that are on this slide. There's a whole RHA line that's not on this slide. There are a lot of good ones. But what are the tried and true? And everybody's going to like, you know, what they like. And again, if we took a poll just you know, and you can put it in the webinar chat, those of you who are on the chat, those of you who inject already, what's your favorite filler for lips, specifically for lips? A lot of good ones you'll see will probably pop up for that. For us, it's going to be Juvederm Ultra, Juvederm Ultra Plus. If you want a little bit more oomph, the Plus is going to be a little bit better. What do we like about these also? If there is a problem, they're much easier to dissolve. I can always dissolve these fillers. Your Volbella, Voluma, Volura, Volux, really not made for lips as much. Maybe Volbella for very, you know, for very subtle lips for that. But all of these are pretty much easy to, the Juvederm Ultra and Ultra Plus, easy to dissolve. Restylane L, Restylane Lift, Silk, those are all good. They have a product called Kiss, which is a little bit of an interesting product there. Some people really swell. They can swell from any of these, but you know, the Kiss is known for some patients really swell. Other patients do very well with it. Bellaterra Balance Plus, the only one not to use on this entire thing. Yeah, keep putting in the chat. I'm curious to see what you all like. There's the Evolus line for this, Revenus Versa, Revenus Lips specifically. These are all really, really good. They're all good. They're all going to be great. We love Revenus Versa and Revenus Lips. Those are really good choices for that. So all will do well. You know what the most important thing is? Make sure it's easy to dissolve. You want something that's not going to absorb a lot of water in lips, because then you go ahead and get a lot of swelling for that. RHAs are fine for that. RHA2, RHA3. If you want something a little bit heavier for that, I wouldn't use Evolus Firm necessarily. Smooth would be good. Versa Lips is hello Ben, one of our faculty members. Versa Lips is a really good choice that we use a lot for all these things. They're all good, but you just want to make sure that it is something that you really know the properties and also can be dissolved if you have to, which is pretty rare for all of that. So you even see in the comments what people like. Let's go to our first video. I'm going to shut off my video, so you're not going to see me, so that you have a little better experience. And let's show you our first case. So here we go. 21 years old, and the first thing that Gen Z and millennials come in for are lip filler. So we've got to give them a great experience, and that's what we're going to go ahead and do here. And so we are stabilizing the tissue, as you can see, with a Q-tip, and then we are going ahead and using the AAFE right angle technique, which is perfect for this because in her case, she wants some lip height, a little bit of volume, but more lip height because she's got some nice lips already. And if she's got nice lips, we're going to give her fabulous lips here. And so that's what we're doing. So we are going in right at the vermilion border, staying fairly superficial on this patient down to the wet dry line and maintain being superficial. That's really important for this. And as you will see, we will go ahead and give her more lip height. They want more vertical height in their lips for more lip show. That's exactly what we're trying to accomplish. Not as much when it comes to projection in this case. Sometimes we don't do projection at all. Sometimes it's all about the volume and the projection here. But you can see how superficial we are as we go ahead and put each one of these struts. And look at these as they literally pick up the lip height. And as you can see, and that looks great. And it will really go ahead and accentuate that vermilion border on her. And she's not worried that much about accentuating the vermilion border. She really wants that lip height, as you can go ahead and see. So we backfilled a few Comfortox syringes. So we will go ahead and start to swap them out and just do only a few injections with each one of those. It's an 8 millimeter, 31 gauge. So it is beautiful. It is sharp. It is very precise, but you are going to have to use a few of them backfilled with your favorite filler, and make sure you use sterile technique as you backfill these syringes there as well. Look at that beautiful pickup of the vermilion height, of the lip height of this patient here on that upper lip here. Now we're going to go ahead and go to the lower lip. We're going to go ahead and do a few things here. We are now going along right above the vermilion border, not in the cutaneous portion, in the lip portion, to go ahead and give that rollout of that lower lip and a beautiful pout, which she's got a nice one already. And we always tell patients if they have nice lips, we're going to give them fabulous lips. And that's exactly what we're going to go ahead and do there. And we're going to do that a little bit on the upper lip too, going kind of a crosshatch from what we did with the right angle technique to really pick up that vermilion, the right near the vermilion border, but give her a little bit more lip height right there here. And so this does not take very long. It's not a long procedure if you're well trained by the AAFE to give these Gen Z patients some beautiful lips. And here again, we are just going to go along the vermilion border, right inside the vermilion border. This is more about rolling out the pout and giving a little bit of volume than it is about making a sharp vermilion border, which really does much better with solid filler smooth PDO threads. But in this case, we're just going to go ahead and use filler on her. But you can see that rollout of that pout and that beautiful version that you create when you do this properly. And again, you can use the filler syringe, but you don't get the kind of precision that you do with a Comfortox syringe with that 31 gauge needle, because that's what it's really all about when you are talking about a 21-year-old patient that's coming in for the first time. We want to really accentuate the beautiful anatomy that this patient has already, give her a little bit of volume, but really give her some lip heights. And now let's go ahead and concentrate towards the Cupid's bow, which we're going to go ahead and do there with, again, a new Comfortox syringe, as you can go ahead and see. And that is starting to take shape just beautifully. And it's part of the technique to go from upper lip to lower lip, then back to upper lip, then back to lower lip, because when you inject filler, what happens? It goes ahead and absorbs some water. So you go ahead and take a look and see what happens right between your eyes and make any adjustments that you need to. Now, smoothing is a skill all unto itself. And it's something that you learn certainly in AAFE training, but most other people ignore. If you learn how to do this properly with some firm but not too firm pressure to smooth out any lumps or bumps, which patients always question you if you leave them when you do these fillers, but also to accentuate the shape. So this is something that you can really go ahead and learn, and it's more of a feel that you will learn in AAFE training there as well. Beautiful result. Now the bottom lip, let's go ahead and roll that out. We are rolling the
filler to accentuate that pout and give us a little bit more lip height while maintaining the projection that we added there. And that is a beautiful result. We're going to finish with ComfortOx lips. And here you can really go ahead and see the before and after. And that's with ComfortOx lips post-care on there already. That is a fantastic result, as you can go ahead and see. It's time for you to learn this, and it's time for you to get AAFE certification trained in AAFE lips, especially for those Gen Z and millennial patients.
So important, those Gen Z and millennial patients. Let me get my video back on here for that. And they don't necessarily have to take very long, but a lot of things that we did just on these patients. And we're going to show you how to use ComfortOx lips. ComfortOx lips is fantastic. You're going to use it post-injection lip care, and they're going to take it home, and that is going to reduce swelling, and that is going, they can use their lips right away. And here you can see, these are right after with some ComfortOx lips on there. You don't have to get big swollen lips every time you get lip filler for that. I mean, I know that a lot of injectors always get these, so a lot of swelling from lips. There are a lot of ways to mitigate it. You just saw some of them for that. But always, some of the important points were always start with the deficient lip. In her case, it was top lip. Then go to the bottom lip. Let the top lip absorb a little bit of water. See how it goes. Go back to the top lip. And really just kind of take your time. But this is a really simple case. And on a millennial, this literally just takes minutes to go ahead and get a really, really good result. But a lot of it is the evaluation and assessment beforehand. That is really, really important. And again, that's what we go ahead and teach in training for that. So, but here's a challenge, and this is something that is good. Here, this patient, was complaining they didn't have much of a top lip. They wanted more of a top lip, but she's got a really nice smile in the pre-op, right on the top picture for that. And then when you get to the after, half her teeth are being blocked by that upper lip when she goes into a smile. I don't know about you, that's not a success. It's really not a success when it goes when it comes to it, because you don't want to hide it. You don't want to sacrifice these really nice teeth and a really nice smile by adding too much filler in the lip. So there's a lot of nuances as to how you do that. And we do a mix of volumization and also what do we want? Do we want lip height? There are a few ways to get lip height. One is going right angle. The other ways of going sideways and doing it with volumization, going closer to the vermilion border. There's just a lot of little nuances that, again, that were good. Does it still look good? Yeah, but she may not like it very much. Why are you hiding all these gorgeous teeth for that? I mean, that's really not what most patients are looking for. They want a nicer lip. By the way, there are other ways to go ahead and do this here as well for that. But yeah, you may like it, and that's all okay. If she likes it, it's success. But if she doesn't like it, you've got a real problem on your hands now. You can go ahead and dissolve it, and then you're back to a really, really tiny little lip on the bottom situation. They need to go ahead. I mean, it's always great to see. It's always great to see, them, not smiling, the before and afters. But this is the most important part: is what do they look like when they're smiling here? What are the possible post-op complications and that you can go ahead and prevent? But you can always get with any filler: bruising, swelling, infection, nodules, vascular occlusion or compression. You need hyaluronidase to dissolve filler. Again, that's, we're going to talk about the 911 in a couple of weeks for that, and also how to use an aesthetic ultrasound for that. But patients will bruise. There's no question that they will go ahead and they will bruise here for that. Don't tell patients they won't bruise, because that's a patient that probably will bruise, and then they're not going to be happy. If you tell them they will bruise and then they don't bruise, or they have very minimal bruising, then you're a hero. If you tell them, no, don't worry, this never bruises, and then they get this big lump out there, a few days before a wedding or something like that, then you've got a problem there. They're going to hate you, unfortunately, for that. By the way, we have a pretty strict rule for we don't do this within 2 weeks of a special event. You do not want to give them fillers necessarily. You don't want to give them Botox either, because they can swell, they can bruise. They beg, then they've got to take on the liability if something does happen. Because again, It's always those people that, it's 3 days before the wedding. They want just a little bit more filler in their lip, and just by Murphy's Law or whatever it is, all of a sudden they get a big bruise on their lip for their wedding. You don't want to do that. You've got to really plan these things out with them ahead of time. We do bridal Botox and bridal fillers all the time, and we start a couple of months before to make sure that everything is going to look really, really good for that wedding here. So don't try to be the hero for that. But can they bruise? Yeah, they can bruise, and today they'll put it on social media, and that's kind of good because it lets people know. Let me show you what that looks like. Here we go.
Okay, lately I've been getting a lot of comments like this, which, first of all, my goodness, thank you so much. Second of all, 1000% I have lip filler. I don't want anyone to ever think that this is what my lips naturally look like. For reference, this is them naturally. You can see there's a difference. Also, there's a lot to unfold in this photo. I don't know what's going on here. I was odd in high school. But yeah, I don't want anyone ever thinking these are natural, because they're not. They're obviously super swollen and like really bruised right now. But yeah, I just wanted to put that out there. But thank you for all the nice compliments. I love you guys.
And they'll show anything. I mean, which again is good. So people really do. This is why they can get so much information on social media. The problem is they can get so much bad information on social media there too. All right, let's take some questions now. Then we're going to show you a couple more cases here, and then we'll keep taking questions for that. I've got a few different platforms to take a look at questions now, so let me go ahead and start on some of these here, but feel free to ask a few questions for that. There's lip height. Just to make it simple, there's a lot more than this involved, but there is lip height, and that is making the lip taller, the pink of the lip taller, without projecting out, so without the volume. Then there's lip volume. That's the projection. That's the rolling of the lip to get a really good pout on the lower lip. There's that combination. So what do you want? You can achieve both. You can achieve one without the other. It just really depends. You don't want to just keep filling up lips so that they are, so big. They're the first thing that walks into the room when the patient walks into a room for that. You don't want these lips sticking out for that. You want nice volumization, but you also, in many cases, want lip height. A deficient lip, and use that word deficient when you're talking to patients about lips, because nobody wants a deficient lip. I mean, it's a really strong word for that. When we're evaluating and assessing for that, we ask them obviously what they want, and then as we're talking out loud, as loud as we're assessing this, we're saying, well, the top lip is more deficient than the lower lip deficient. What does that mean? Well, you don't have a lot of volume on there. It's just the whole thing is not balanced for that. Well, I don't want that. I mean, I want them in proportion for that. So deficient is a very, very good, strong word for that, and that's that. We always start injecting with the deficient lip, because if the other one's got some nice volume already, you don't want to start there. You would probably, many times I just started on the one lip, and all of a sudden I'm pretty close. That looks pretty good in terms of proportion for that. Let's take a look. Let's take a look at some of these here. Let's go. I don't know how many mLs to inject with each injection here. So it's really what you see and what you get. How much filler goes with each injection? What you see is what you get. That's the beautiful part about hyaluronic acid fillers for that. And you're always going to get a little more than that, because they are going to swell or attract water depending on what you're using. If you're using something like Versa or Versa Lips by Revanesse, that's going to have the least amount of water absorption, which is very much what we want for many things. We just have our own rule that we never put more than 1 ml. Most of those syringes are 1 ml. Some of them are a little bit more than 1 ml, but most of those syringes are 1 ml syringes. We never put more than 1 ml into lips on any given appointment. That includes upper and lower lips. And this is a really big rule that we have in the AAFE. If you've been AAFE trained, you've heard me say it, and all of our people say it numerous times for this. If they have really thin lips, at an appointment, I can give them nice lips, but I can't give them fantastic lips the first time out. If they have really thin lips, you've got to go ahead and get them nice lips. Then about a month later, we get them back, and we can go from nice lips to fabulous lips, depending on how much volume they want. for that. And that's why, because what happens, think of lips like balloons. Kind of, it's a loose analogy, I think, but it's kind of like that. Think of lips like balloons. A balloon can only hold so much air or water, and after that, it bursts. In lips, they can only hold so much filler. Now, thankfully, they don't burst. Thankfully, when you overfill them, but that filler is going to go somewhere, and where's it going to go? It's going to go into surrounding tissue, and that's where people get this lip mustache outside the lips. So some they've got filler there that you're going to have to dissolve a little bit later on. For that. So lips can only hold so much at any one appointment. And we have a lot of patients that, let's do this. They look really nice. Let's get you back in a month. If you want more, we can go ahead and give you more. If not, then you'll be fine. But we can check them in a month. Most of the time, they don't want that unless they really want very full lips. But if they come in with thin, you're not giving them very full lips on the first time. If you give them more than 1 ml, and that includes upper and lower, 1 ml syringe for both lips, not 1 ml for each lip, then that's that's where people get into a lot of trouble, is overfilling lips first time out. For each one of this. Let's take a look. For that, I'll show you the vascular occlusion Zoom link in just a second for that. And we're going to show you the next. We're going to show you the next case, which is going to talk about for most of these needle depths are fairly superficial, as you're going to see, because deeper than that you're going to start getting into arteries, which we don't want. Backfilling syringe, you can go on our YouTube channel. There's to show you how to backfill a syringe using sterile technique for there. For do we aspirate lips? Sometimes we do, sometimes we don't, but typically we're going to stay very superficial. We also use ultrasound on a lot of lips, so we know exactly where the arteries are for that. We'll get into some of these questions a little bit later on. For that, my threads are tiny 0.01, taking into account lip quality effect than you're trying to achieve. That's fine. You can go 0.01. It's going to take you a longer time. Sometimes we do, but most of the time we give more than 0.01 on any given injection, but not much more for that. Let's take a look. I don't know what 1/2 a sussing per lip means. I don't know if that's that almost sounds like a Gen Z term, and I don't speak Gen Z that well for that, but I don't know if that was a misprint or whatever that was. So let's take a look. Average fee for injectors charging for 1 syringe of lips. That can be all over the place for that. That can be twice the amount of the syringe, 3 times the amount of syringe. We typically charge, for lips because we're usually doing a lot of other different things for that. We like to charge more for a lot of different things. We usually are into comprehensive care for that. If I think I'm a little deeper, I will aspirate for lips. If I'm exactly sure of where I'm at, we don't necessarily aspirate, but we do aspirate a lot for that. Aspiration is one tiny little data point. It's not the most important thing you can do. It's probably the least important thing you can do. Doesn't mean you shouldn't do it, but if you do it, it's fine. If you don't do it, it's also fine, as long as you know exactly where you are for that. The most important thing is watch it fill up and watch for any changes of the color of the tissue. That is the most important thing that you can do. Aspiration gives you're in one little place, you pull back. Is there a backflow of blood? First of all, it doesn't mean you're safe, even if there's no backflow of blood. And if there is backflow of blood, great. Just take it out and go somewhere else. But every time you move that tip, you're in a different plane. So aspiration is, if you like to do it all the time. But most people don't do it all the time, especially for lips, because you are going to be very, very superficial for that. We never go 90 degrees. We rarely go 90 degrees. We go 90 degrees if we're doing right angles. I don't know if that's what you mean by 90 degrees. We never go 90 degrees to the tissue and are going like smack into the tissue for that. But let's show another case for this. Here is the bonuses there again. A bunch of you, I got, again, a lot of different platforms going. Bonus number 1 is the Master Lips Online Certification course. That's one question, and I'll show you a little bit later all the different techniques we show in that there as well. But this is a total package value of $13,000. any 2 live patient certification courses. Doesn't matter to us. You can take, if you're just getting started, again, your level 1 Botox, level 1 fillers is going to be the 2 choices that many of you are going to take. If you want oral facial pain, to level 1 Botox, level 1 TMJ oral facial pain trigger point therapy probably are good choices. Now, I'm sure they'll make you a deal if you add on a 3rd course for all of that. Level 2s are for people more advanced. Level 3 is really advanced master courses. And we have master lips and master eyes, and we've got PDO threads, lifting PDO threads, and smooth PDO threads, and PRP, and we've got hyperhidrosis. We've got a lot of different choices for you to go ahead and take advantage of. So really lock these in. By the way, you can use this now. If you were asking this question before, you can use this now. You can use this a year from now. It doesn't really matter. You'll get all the bonuses no matter when you go for it. But I mean, use it now. I mean, that's really what it is for this. All right, favorite numbing technique and product used prior to injecting lips. Best one out there is a ComfortTox product, ComfortTox BLT, best numbing agent that's out there. You can get from StatDDS. I'll show you. I'll bring up StatDDS again for that. All right, let's go. Yeah, these are going fast, and congratulations to any of you who have gotten this already. QR code or go to AAFEspecial.com and lock this in. That is a great value. Here's what a lot of you are asking about. This is in 2 weeks. This is a live virtual training on filler emergency protocol to reverse vascular occlusion and necrosis fast. You're going to see that patient that was in our chair, and we'll show you exactly what we did on her, but we're going to show you step by step. We're going to give you forms that are worth $199 for informed consent and an emergency protocol sheet that you can put in every treatment room, and you'll always have it available for that. Plus, in this one, there's a 14-day replay for that, and pre-op and post-op medications, and a whole lot more. So you can see the whole description. Go to AAFE webinars.com or go to that QR code, and that'll take you there. It's only $79 till midnight tonight, and then it goes up. You're going to see a Botox technique. You're going to see it right now. So let me cue that up for that. Yeah, one way to do it is dental blocks for sure. You're talking about anesthesia techniques for that. If it's a game changer for sure, but a lot of patients don't want dental blocks. There is lidocaine in most of these fillers, and that helps. Doesn't help with the first poke. That's what that ComfortTox BLT is really, really good at for that. Let's just go show you a quick. Is Gen Z also getting Botox? Yes, where Gen Z is getting Botox, mostly preventative Botox for that. How does Botox work? For those who don't know anything about Botox, the quick and simple explanation is Botox affects muscles. So that Botox affects muscles, and you are injecting your neurotoxin. I'm going to call all of them Botox just for now, into the muscle. It's going to go straight to the neuromuscular junction. How do muscles, motor muscles flex? How do they contract? How do they know? The release of acetylcholine. The neurotoxin blocks the acetylcholine. But the important thing is it takes 2 to 4 hours to really start to get to this neuromuscular junction. Then it takes anywhere from 1 to 10 days to really kick in. 10 days for all toxins for full effect, but they'll start feeling it in 1 to 2 days for most of the toxins as well. It depends on the dosage and a lot more. I'm not going to get deep into Botox. Just want to show you that, yeah, Gen Z gets Botox there already, but being a great Botox injector is all about the anatomy. There is no way about it. You better know these muscles inside or out. And like I said, the AAFE is anatomy crazy. I'm just going to demonstrate one quick Botox, and these are quick Botox injections on Gen Z because a 20-year-old, how much do they need already? They may have fine lines developing. They may never ever want to have lines developing. But let's go ahead and show you a quick Botox case here as well, so you get a taste of it. But they're getting it. It's amazing to me. Here we go.
Patient is 20 years old and getting some botulinum toxins. So, what are the considerations? Well, you've got to make sure it's a great experience for this patient. Let's start with the frontalis and the glabellar area. That's all we are doing right now. ComfortDoc syringes for the best comfort because you want them to come back forever. But it's about precision and making sure that you understand on a patient like this that they have very tight skin and very tight muscles here. And that means that you have to be precise. You're not going to get a lot of volume and diffusion here. So you have to know exactly where you want to go ahead and put it, as you saw in the frontalis. And you must adjust the dose. And that's important. They don't need as much as an older patient because they have not made those dynamic wrinkle lines in the skin. That's the Proceres injection. Now let's go with the corrugator injections. This whole thing is not even 2 minutes. It's less than that. Here are the corrugator injections. Make sure you are placing it exactly where you want it. Hold that properly as you see being done so that you don't get any movement of the botulinum toxin down into the eyelids, and make sure we are not using a full dose as we would with an older patient. She doesn't need it because we just are doing prevention now to prevent those wrinkles from going ahead and getting deeper over time here. So we just want to weaken the muscles. You may not have to knock them out. Now, cleaning this is so important. Up and away from the eyes constantly. You want to make sure you go up and away from the eyes. So make sure you don't move it all around a lot and give them proper post-op instructions. And here you see before and after. Now, you don't see much when it comes to a prevention case like this, but you don't want to drop the eyebrows. You don't want to drop the eyelids. You want to make sure that the patient has got a little bit of movement because, again, we are talking about prevention. So she doesn't need a full dose because she doesn't have the muscle intensity that an older patient is going to have. And that is demonstrated by not having the wrinkles that she has so far. So that's what prevention is all about with a 20-year-old. So make sure you know those considerations, and it's time for you to learn how to do this and time for you to get AAFE certification trained today.
And I mean, these are the easiest cases, literally the easiest cases for that. You're going to go very, very light on units. On a case like hers, just to answer the few questions that are right here, right now. On a case like hers, the biggest determining factor for forehead dosage of units. And again, if you've never done Botox before, don't worry about units and dosaging and that kind of stuff, because that's what we spend all day in training to make a 3-minute procedure looks super, super easy. And it is when you're really well trained for that. But the biggest determining factor for frontalis Botox is, who knows what it is? Put it in the chat if you know what it is. If you've been AAFE trained, you will know. If you haven't been AAFE trained, you won't know this because no one else teaches it. For thank you, all of many of our AAFE trained, or you've been on some of our webinars before. It's not muscle movement. It is depth of the eyes, eye depth. Okay, do they have shallow, medium, or deep set eyes? Thank you, all of you. All of you have been AAFE trained or been on some of our more involved webinars on Botox techniques for that. If they're shallow eyes, you better be super, super light on the Botox or you will drop their brow. By the way, take a look at her eyes. Does she have shallow, medium, or deep eyes? What do you think she's got for that? What do you think she's got? Shallow, medium, or deep eyes, right? There she's got shallow to medium, not super shallow, but shallow to medium. And she's young, and this could be called baby Botox as well. And she's young. You better be very light on the frontalis. There are many people who will teach you on a patient like this to give her 10 to 15 units of Botox in her frontalis. I guarantee you she will be so miserable for 3 to 4 months because you will drop her eyebrows. She will hate you and she'll never be coming back to you. She may never get Botox again. She'll get this really heavy feeling for that. That what you saw in 3 minutes takes an AAFE level 1 all day to teach to get perfect results, and it's about precision for that. It looks super easy, which is why so many people get bad results if they kind of learn this from YouTube, or they take other courses that really don't understand the anatomy. Anatomy is not just about muscles. There's so many other things for that. I'll do more questions later. I just want to get back to our main topic because I've got a longer involved case for lips that's going to answer a lot of your questions here too. I showed you the easy case first. Now let's go to something a little bit more involved here. But this is what we're going to do. Proper evaluation, consultation, give Gen Z what they want. Some of them want a little bigger lips. We're going to go a little bigger on this next patient and show you ComfortTox lips and show you where to get it. Choose the right technique, precision placement. You're going to see all that. Nobody wants to be a no Botox Barbie when they get older here. But let's go to another Gen Zer here. Here we go.
I'm finally getting my lips done again. We all knew this day was coming. You think I can have no top lip for that long? The difference between this time and the last 5 times I've gotten them done is that I'm going natural today. I also researched and precisely picked the person who's doing my lips this time, so I didn't make a last-minute appointment with someone random this time. Anyways, let's get them done. We started with numbing. Here's how my lips looked before. Where's the top lip? Someone tell me where it is, because I can't find it. It came out to 675. And here's the final result. I love them. They look exactly what I was going for. And keep in mind, this is them swollen, so once the swelling goes down, they're going to look perfect. I love them.
Now, again, maybe she has 10,000 followers, maybe she has 10 million followers. What she just told a Gen Zer in that I don't know, 30, 40 seconds is, you look at my top lip. I think she's got a top lip. She wants something a little bit more. Numbing, really happy afterwards. How much it cost? I mean, it's made our job so much easier. I mean, really, it's just incredible the world we live in for that. All right, here are the needles we used before. Here are the needles we're going to use again. And these are called ComfortTox needles. Anything called ComfortTox, you're going to get at statdds.com. They make the best BLT, which is the topical anesthetic. It's shown here as well. The best syringes. Why? Because you want to be known as the most comfortable injector. That's what you want to be known as for that. For that, you need the sharpest needle, because that is going to slide into the tissue with the least amount of trauma for that. Right out of the box, right out of the package, look at a ComfortTox and look at not a ComfortTox, which is another very popular brand of needle that is used for injecting Botox and injecting filler. You want them to barely feel it and less trauma. Anything can cause bruising, that's for sure. You've got to know your anatomy. Always use the sharpest needle available. It's also the most reasonable in price for that. So that, if you want to learn how to backfill, like I said, go to the AAFE's YouTube channel. There's a video there. We teach it certainly in our courses. Make sure you use sterile technique, because all these things are sterile. So with that, let us go to our more involved case. And this is going to answer a lot of your questions. So here we go.
Gorgeous case of lips coming your way, and wait till you see the afters, and we'll certainly point out a few things here. But take a look at this lip. Not much upper lip. That's definitely deficient. A nice lower lip, although she wants fuller lips, but still wants to maintain some kind of proportion here. So let's take you through a very specialized AAFE technique. First, we are going to start with the more deficient lip, and we are going to do right angle. Backfilled ComfortTox syringe with the filler of your choice here. And here we are using a medium filler that's going to give us some plumpness here. Take a look exactly where we are placing this. These are superficial injections going from a right angle from the vermilion border here, but we are starting in front of the vermilion border here and staying very, very superficial to give this patient some height. We want some lip height to develop first. Then you're going to see we're going to go treat the lower lip and then come back to the upper lip after it's absorbed a little bit of water, and we can see how much volume it needs extra from that. So you can see these are going to go down to the wet dry line. We are stabilizing the tissue with a Q-tip, so you can go ahead and see. You'll see a little bit of swelling start to happen, certainly bleeding, especially on this patient. The lips are very well vascularized. Some patients bleed more than others on here. But take a look. These are very, very carefully placed injections, and we are staying fairly superficial, so we are not worried about the labial artery, even though we have not done all of our checks with ultrasound. We've taken a look at the lip beforehand. It's about anatomy, safety, and technique when you're going ahead and giving filler injections here. You can see it even blanches the tissue. That's how superficial this is a little bit, but then that goes away right away. Sometimes we start right at the vermilion border going down, sometimes even behind the vermilion border. In this case, it is really about pure lip height, and the vermilion border was fairly well defined already, so we did not want to mess with that, and that's why we are starting just in front of the vermilion border going into the lip tissue. Certainly it is a little bit pinchy for that. Even though we use some topical anesthetic, this patient is a little bit more sensitive for here. Don't forget about the medial aspect of the Cupid's bow, and that's going to be important in really shaping that upper lip on this patient. Some patients more naturally have that, not on this patient. As you can see, she was a little bit flatter across the philtrum, and now we really want to go ahead and accentuate that. So now you can see that upper lip has got some more lip height, and that looks really beautiful. The lower lip didn't need as much lip height. It needs more volume, and we want to roll out that pout, and that's exactly what people love. A rolled out pout. They want more of a pout, and that's why these injections were giving a little bit of volume, very controlled, very precise, with a backfilled ComfortTox syringe to roll out that pout. And we use numerous ComfortTox syringes because it is a 31 gauge needle that can get dull after a few injections here. So we've got a few that are on the tray ready to go for this patient here. We are going to go all the way to the oral commissure on one side, rolling out that vermilion border and that pout and the rest of the lower lip just to give it a little bit more plumpness, which is what you want. She doesn't want giant lips. She wants, some fairly full lips, but none of these giant lips, and it's going to look spectacular on her when you go ahead and see, because she's getting ready to go ahead and, maybe go to someone else's wedding. She's going to be all made up, as you're going to see, and we'll certainly talk about that when we get to that. Now we go back to the upper lip. After you did some lip height and then it absorbed some water, now you go back and fill in some volume on the upper lip. And again, this is going to be really depend on what the injector is seeing at the time, where there's some deficiencies in the lip, where are there areas that need a little bit more volume. So again, it's about precision. Too many times people think lip enhancements is just about getting as much filler in these lips. No, all of these lip enhancements, especially the way the AAFE trains, is all about precision, and every injection is given with a precise goal in mind. And here again, we are close to the vermilion border that's going to maintain and even lift up that lip height just a little bit. And when you crosshatch like this, right angle going up and down, these going side to side, that really goes ahead and buttresses that lip to give us a nice smooth lip all the way around. So now we're going to go ahead and do some smoothing. And I don't know why people don't teach more smoothing. The AAFE is very big into smoothing because we're getting rid of any lumps or bumps or anything else like that as we go ahead to feel that filler, make sure it's even. If it's a little lumpy or we need a little bit more in one area, we will actually kind of gently push that filler there. We're not flattening anything out. We're going to make sure that we're going to maintain the pout. We're going to make sure that we maintain the anatomy. And now let's go to ComfortTox Lips Post Care.
Hi everyone, Bridget here at the AAFE Training Center. We just filled this beautiful patient's lips. So now we're going to go in with our ComfortTox Post Lip Care Kit. So this kit comes with a serum and then a balm that goes over top. It has hyaluronic acid, arnica, essential oil, so it's really great for healing. So first, I'm going to go in with the serum, and you'll have to twist it a lot before you use it for the first time. And then I kind of let this sit for maybe like 20 seconds or so. And then I will go in with my balm, and it comes with this little brush that you can apply it with to keep everything clean. We tell our patients to use this at least 3 times a day for 3 to 5 days. We don't want them using any other products, so no lip gloss, no like Vaseline that's been in their bathroom for years, nothing like that. We want to keep the area really, really clean. So this is going in with the balm, and it's really nice for after pictures as well because it makes them look really juicy and hydrated. So they will just go home with this kit. And we're going to see her back in 2 weeks, see if she needs any more filler. But this will be really great for her healing period. Thanks so much for tuning in.
And now let's show you this gorgeous before and after. And these are immediate lips, swelling, bruising, all gone, all down because of using a very sharp needle with the Comfortox syringes and also Comfortox lips to really control it. And patient will use Comfortox lips for a week afterwards. And Bridget did a fantastic job on this before and after. Patient is in love with it. But then you really know they're in love with it when they send you these selfies afterwards and they love their lips done at the AAFE Training Center and with Bridget and all of our faculty there. Now her professional photos, I guess she went to some kind of special event, got all made up. But now let's take a look at these lips from this perspective. Of course they look great because they've got a foundation. You go ahead and get all made up. But here coming is going to be the real kicker here. How do you know you did a great job? When they go into different motions and those lips look supernatural and they're the right size for this patient and this is what she wanted and they function normally and the patient now smiles. Look at that smile. Many times lip enhancements are done by giving patients full lips, but when they go into a full smile, it hides half of the upper teeth there when they go into a full smile. These lips are exactly where you should be when you go into a full smile. They should be the bottom of the upper lip with the lip enhancement should straddle the gingival margin, the margin of the tooth when it touches the gums. That is a perfect aesthetic smile. Those are the kinds of lips that you want after you do a lip enhancement. And those are real AAFE lips using different techniques. It's time for you to learn this. It's time for you to get AAFE certification trained today.
And that is super, super important is that, and that's what I said before. She got a lot of filler in her lips, but it's not hiding their teeth, and she's got beautiful, beautiful teeth for all of that. I mean, again, that's an advanced technique in terms of that. You have to know exactly where you're putting that filler and keep asking questions. We'll take questions in a little bit for that. We want to show you a few more things for that, but absolutely, that is what you want when they're smiling. You do not want it to hide teeth. Again, if the patient doesn't mind, then that's okay. But, you know, again, this is all relative. You may like it when they hide teeth. We personally don't like it. That's not me. It's what does the patient want and what does the patient like or not. Most of them do not want their teeth hidden by overfilled lips that go all the way down. What we did here is we filled them up and not down. And that's a matter of placement and where are you placing this filler. Again, it's not an easy answer to do because you got to show you, and that's what training is really all about for all of that. So it's really about that smile for that, and big lips are still in. She likes them, but again, she didn't have a lot of swelling because of that Comfortox lips. It is fantastic. It is really fantastic, and you can get it at statdds.com. Now you saw it, what it looks like in motion. This is a balm and serum. They use it usually for a week afterwards. Some patients use it for months afterwards, and they keep getting it. I think the package, don't hold me to it exactly, costs $30. Just included in the cost of your lips. Whatever you want to charge for lips or the syringe, add $30. The patients, it's transparent to the patient. I'm not getting into a discussion whether or not they want it, pay extra for it. I want them to have it, but they should be paying for it because they'll look better. They'll have very little swelling, very little downtime. Everyone wants lips, and they want to use them right away. They want to show them to everybody right away. They don't want to hide out for 2 weeks. You know, we see these memes many times where, oh, you get lips, and then you got to hide for 2 weeks. Tell your patients, that they're going to swell for 2 weeks. Why? You got to use a really sharp syringe. Use the right techniques. Use Comfortox lips. It's great. So, I mean, this is a minimal price to pay for all of that, and that's how we include it for all of that. AAFE lip volumization and aftercare. I mean, we can give the patient any kind of lips that they want, even if you just do volumization, which is what we teach in level 1. Level 2, we go more advanced lips. Level 3, even more comprehensive lips and care and that kind of stuff. And again, we have that master lips course that we talked about. So I can show you big lips. I can show you small lips. I can show you a lot of different Gen Z and all age lips for that. That's a patient that we saw before for this. And this is a patient that came into the AAFE training center. Again, those are immediate afterwards, a tiny bit beat up for that. She also got neurotoxin. She's got close to 3.5 million followers for all of that. It's just really, really incredible what social media has done for literally she's 21, 22 years old. I mean, it's crazy to be that young. Not crazy. This is what people are doing these days. To me, just because I'm older, and when I started, it wasn't like this. To start this young and also have that much influence and having 3.5 million followers is really something else. But let me show you this, because this is really incredible. They're just getting started. That's the point. You're going to build your entire practice on these kinds of patients if you're properly trained and you're really good at what you do. And again, if you have the AAFE backing you up, because those are the most successful practices, we've got nearly 20 years of experience, and we know our members, the thousands of members that we have, and we know exactly what they're doing. That's how you be really successful. This is just the starting point. What do I mean by that? Watch this short video, which they post online, which is really incredible. Here we go.
Starting from the top, I obviously had Botox. Then I had Sculptra in my temples. Then I had PRF in my under eyes. And then I also ended up getting filler in my under eyes. Then I got filler in my cheeks. Then I got I got a nose job. Then I got filler right here to like minimize the smile lines. Then I got my lips done, filled, and then sometimes I do a lip flip, but I haven't been doing the lip flip because I just got my teeth done, where I got Invisalign and bonding. So I like my teeth, so I don't want them to cover it too much. Then I got masseter Botox to slim my jaw, and then I got chin filler to kind of give that elongated effect. Botox in my tech neck lines.
You didn't tell me that.
And I think that's it.
Oh, you also have extensions.
Okay, I have extensions in my hair colored. Don't judge me. Just want to say I am taking care of the sun damage.
Okay, I mean, what she just described, just for injectables, okay, is thousands of dollars every few months. And they'll do it, aside from the nose job and aside from the teeth. And again, if you do teeth, then that's even more. This is what they are doing. Look what the possibilities are. Even though we just started with Botox, a little bit of Botox in this presentation, and a few lips. This is what builds your practice, and this is what the AAFE teaches. All of it except the nose job and except the teeth. I do that separately for dentists there. I mean, that is it. And by the way, it doesn't stop at the neck necessarily. So if you're a medical professional, you're doing all over the body. It's incredible. And there's pedio threads, lifting pedio threads. Those of you who want to stay for extra credit, I've got a great lifting pedio thread. If you want to see it, put in the chat. Enough if you want to see it, then I'll certainly go ahead and show you the way to really do lifting pedio threads, which finally there's something that they are too young for that. Okay, if you guys, I got a lot of people on different platforms want to see it, so stick around for that. But first, we're going to take some questions, and we're gonna so keep asking questions for that. A lot of training questions, so let's address that. And we'll talk about fees a little bit there. We'll talk about fees there. Again, final call for this, 2 weeks. For those of you who inject already and you want a real emergency protocol that you can always go to, you want an informed consent, you want to see a step-by-step how we reverse this patient, a real vascular occlusion and tissue necrosis, full video demonstrations, plus pre-op, post-op medications, a whole lot more that we'll do. 14-day replay and all the informed consents, the informed consent that you need, which usually the AAFE sells for $199. Vastly reduced. If you want it, QR code or aafewebinars.com till midnight tonight. If you want to pay more, that's okay. I'm sure the AAFE will not mind if you want to go ahead and pay more. So again, here is let me just show that deal. A bunch of you have grabbed this deal already, and that's great. There are only 20 packages between now and midnight, or the first 20 that go. And again, I'll answer whatever questions you want to put in there in just a couple of minutes. But to answer all the training questions, this will be a lot quicker and a lot simpler for that. These are ready to inject patients, and you will be injecting paying patients in as little as 14 days for for that. Again, that's up to you, but we're going to push you to go ahead and do that. This is what the AAFE courses are really all about. We're going to train you how to be the best injector, not how to be a Botox injector, because they can buy Botox anywhere. You don't want to be like everybody else. You want to be the best injector. These are the people that are going to train you on live patient. They are the best faculty in the world. They're all real life injectors. They have very successful practices, so they can talk to you about any part of the practice, but they are the best clinical injectors that are out there. And I'll tell you one of the things. They're all kind of like on social media, some more active than others, but they don't have time to be on social. It takes a lot of time to be on social media. I will tell you, the best faculty, the best injectors in the world are probably not the ones on social media as much, because they're busy. They're really, really busy. If you're not on social media at all, you know what I'm talking about. It takes a lot of time. You can't be injecting and doing social media at the same time. So I've always contended the most successful injectors, probably not going to find a lot of them on a lot of social media for that. This is where we give our courses all over the country. We have our own training centers in some cities where we give most of our courses every single month, and we're in all these other locations bi-monthly, quarterly, and sometimes even more, more often than that. So that's where you can find these live patient courses. Again, there's going to be a virtual on demand that you have to complete before. When you come to the live patient, this really minimizes your time out of the office. You're going to go straight to doing live patient, and you will be ready because you've done all the didactic and lectures and video demonstrations you're going to see beforehand. So that's how that works. And here is the offer once again. I'll show you a list of courses, but there are even more that I'm going to show you for this. Packet $32.97, which is the most minimal investment you will probably ever make in your life for the biggest return that you're ever going to get. You've all spent a lot of money on medical, dental, nursing school, and any other school that you want. And you will, you've made bigger investments for maybe not as much of a return for this. This will be by far the best return you're ever going to get. Plus, you're going to get all these bonuses. You can choose any 2 live patient certification courses for that, and you're going to get the Master Lips Online certification and all these other things. I'll show this in a minute. Here are the courses you can choose from, and that is going to be level 1. If you're just getting started, level 1 is where you're going to start. Level 1 Botox is one course. Level 1 filler is one course. So that'll where you'll get started. If you're a dentist or anybody that likes oral facial pain treatment, you may go with level 1 Botox plus level 1 frontline TMJ, oral facial pain trigger point therapy. I'm sure the AAFE will add on at a discount if you want to add on more than once. For that. And then you've got level 2 is advanced, level 3 is master. These are the most comprehensive courses that you'll ever take. Our level 1 probably is equivalent to level 1 and 2 in most other training organizations, because it is that comprehensive, and you will be ready to inject because we're going to make sure of it for that. We have cadaver lab ultrasound training. That's actually 2 courses in one. Which is an amazing course on its own. PRP, PRF, all kinds of things that we've got. But here are the bonuses again. I'll just go through this really quickly. And again, first 20 packages are till midnight tonight. Total package value is $13,250. So there's a QR code, or AAFEspecial.com. You're going to get the Master Lips Online Certification course. By the way, this is a lot of CE that you are going to get. I will probably venture to say it's probably close to 20 plus CE hours. I can't remember exactly what it is. But Master Lips Online Certification, worth $997. You're going to get up to $750 of injectables to be used at the course. You are going to get the Med Spa / Aesthetic Practice Business On-Demand Training, worth $597, whether you're going to be an employer, and it'll take you through options. What are the legal entities? How do you want to set this up? Malpractice insurance, how to consult with patients, how to get patients, social media. It's going to give you a lot of different things. Or you want to work at a med spa, it's going to give you all the consultation and everything else. You'll have whatever you need at your fingertips for that. Exclusive member forums and post-course support, worth $997. A team member per course, worth $750. 12 months of AAFE membership worth $597. AAFE member office locator worth $997. That's a year's worth of being on the AAFE member office locator. We get a lot of consumers every single day, every single week. They come to the AAFE website looking for AAFE providers because they know us and we've been around for quite a while. Use of the AAFE logo in your practice worth $997. Office forms, discounts, a lot of other things that make up that package. And that Master Lip Online Certification course, which you could buy separately for $997, you might as well buy the package and get all the live patient training and everything. It's going to go through lip flip. It's going to go through advanced volumization. It's going to go. You only saw maybe 3 of these techniques in the 2 presentations that I showed you on lips, but for a lot more, there's a lot more you can do with lips, and it's really, really incredible. All right, with this, I will take some questions. Let's address fees for lips and how we look at fees a little bit. Let's take a look at, I'll show a lifting PDO thread case for those of you who want to stick around after we take some questions here. Thank you, Haley, for helping out and taking questions. You can email Haley at just look through the chat and you'll see your email, haley@facialesthetics.org, and you can see that. We're going to cover injecting nasal fossa, piriform fossa sometime soon. Sure, it'll come up in an upcoming webinar at some point. Let's talk about fees for lips for that. Well, we look at it as if you really get good at lips and you get more advanced, then you should be charging a premium for lips. The easiest way to do it, the way a lot of people start, is by the syringe. So I said, for us, we're going to use a 1 ml syringe for lips. First appointment. So for that appointment, if that syringe costs you $300 to $400, you may be charging $700 to $800, $600 if you want to go less for that. But the problem with that is it becomes a real commodity. It's an easy way to start if you're just getting started and you want to get some experience for that. But once you get good at lips, and we're going to make sure you get good at lips if you get AAFE trained, because it's such an important that's the skill when it comes to fillers, especially for Gen Z. We're going to make sure you get really good at lips. What's amazing to me is there are many level 1 courses by other organizations that don't even don't even train on lips in level 1, which is kind of crazy for that. There's enough to learn on lips that you can definitely should get in level 1 for that. But lips are absolutely they're fun to do. But you gotta know depth. You gotta know proper depth, even though most of it's gonna be superficial. You gotta know your anatomy. You gotta know all those different things for that. But lips, that's why lips are so important. But if you want to start by the syringe, that's fine. But it becomes very commoditized. You'll get a lot of, well, you're charging me $700. This person is charging $500 per syringe. How can they do that? Where are they getting their syringes from? There are a lot of fake places that people can buy stuff from, which you should not do because it's illegal and it will always come back to bite you for that. So for that. But once you get good, and once you take a level 2 with the AAFE and you get more premium, you're going to be setting lip prices that that have got nothing to do with the syringe. With us, a lot of cases we're doing, again, a lot of different care. So they're getting a total fee for all the different injectables that they're getting. So they don't even know what they're paying for lips, but because it's part of facial balancing. So that's when you get more advanced for that. But we see in the AAFE a year out for people that we train for level 1, easily the average is they are adding about $32,000 per month to their practice just doing injectables, which is not hard to do when you're charging a minimum of, most of the Botox cases are $600 to $1,000 easily. I'm saying neurotoxin, I'll use Botox just as the word. Filler cases are another $1,500. Very easy to get to $30,000 a month if you have an existing practice already, or if you're just seeing a minimal amount of patients for that. So there's so much that you really can go ahead and do that. Ask Haley is for an option of 3 courses. You can grab this deal, and they will give you a deal for the third course for that. But this is a fantastic package. Congratulations. I don't even have access to a lot of the names to congratulate you, but the AAFE will be getting hold of you tomorrow and getting you the location that you want, getting you set up with, you'll tell them what courses you want. You'll get immediate access to the on-demand. And again, you can just lock this in and take this next year. I mean, you can really do this whenever you really want to go ahead and take these courses for all of that. So that's really important for that. Okay, so Sue's also interested in 3+ courses as well. So go ahead and email. Let me put Haley's. Okay, Haley got this covered. Thank you for helping out here, Haley, because there are a lot of messages coming in here. Let me see if there are any other questions about this. I'll show PDO in just a second for that. This is the most fun you're ever going to have in medicine, dentistry, nursing, or whatever else. I mean, it is really, really a great thing. There's not an additional code. Right now, it's $79 for that vascular occlusion course in 2 weeks. So if you want it, get it. That is a deep, deep discount. By midnight, it goes up. By midnight, these offers go away for that. We have a whole separate thing. Lip flips take about an hour to teach because they are so precision for all of that. All right. So yeah, you can respond here. Grab the package. They will add on a third course for you for that. Just do it. Please do it before midnight. Do it before 20 packages are gone. What's let me just see if they texted me. There are about 15 packages in, and they're gone. And once they're gone, they're gone. So that's all they're offering tonight, 20 packages or by midnight tonight. So if you're going to email Haley, because she's on, Haley at Facial Aesthetics, let me just put it in the chat for those of you who may have missed it. Make sure you get hold of her before midnight tonight. They're not going to hold packages on her because they are going to go. So I just went ahead and, oh wait, I didn't put that for everybody. Did I get that for everybody? Did everybody see that one? Let me just put that in again. All right, here we go. Let's do the easy way. All right, going to show that PDO course real quickly here. Do that again. Okay, you can hear me typing. That's good. All right, there you go. So email Haley if you have any questions, but it's by midnight tonight. So I hope that was helpful. But here is the resource slide. I'll show you again. And here's my email. I'm going to go directly to a PDO course for that. Keep asking questions, though. I'll hang around as long as you want to hang around. There's my email. If you have any questions for me, there's Dr. Lewis at facialaesthetics.org. There's the AAFE's email or Haley's email we put in the chat for that. AAFEspecial.com, that's the tuition special. AAFEvirtual.com is a smooth PDO threads. I'm going to show you lifting PDO threads. StatTDS, everything Comfort Docs. They also sell the injectables. They're authorized distributors for Radiesse, for Bellatoro Balance, for Xeomin, for Revenus Versa, so you can go there for all the Comfort Docs lines for that. Vsoft Lift, I'm going to show you their threads in just a minute. AAFE has a fantastic online certification course for PRP and PRF, so if you want to go there, that would be great. Best Aesthetic Ultrasound, waveaesthetics.com if you want to see the Wave FE, and AAFEwebinars.com to show upcoming webinars like that 911 course. All right, with that, I'm going to jump into PDO threads, lifting PDO threads, which are so fantastic when they are done right. This typically is not going to be the Gen Z patient. It's going to be the older patient. All that gelling, all that, everything that falls with gravity. She's lost collagen and fat in her face, and everything has descended down. How do you pick it up? Fillers is not going to pick it up. I don't care what you read or what studies you see. I mean, there are studies that filler will lift about a millimeter. That's not a millimeter. That's a millimeter. Can you see? That's a millimeter. That may not even be a millimeter. I don't think I can measure it with my fingers there. What is a millimeter going to do on her? Honest to goodness, nothing. You need a physical lift, and that's what lifting PDO threads go ahead and do. I'm going to give you a very, very quick course. It's really just to show you the AAFE technique. Much different than anybody else. Use our entire way of doing things is the minimal amount of threads with the maximum result, not the most threads you can throw into a face with a good result, right? It may be good, but we're going to show you how to get a great result with fewer threads. For that, you need the strongest thread available, and that is going to be V-Soft Lift by far. FDA cleared class 2. I could not tell you that enough. Most of the threads on the market are not FDA cleared class 2. For their line of threads. That's important. They may have one thread that's FDA cleared, but not their entire line of threads for this. So V-Soft Lift is by far the best. Why? Because they are the strongest. And what does it mean that they're the strongest? It means I need the fewest amount of threads for the maximum result. And there are, again, I'm not going into the whole thing now, but there are barb threads, and you can certainly use your courses that you lock in with whatever deals you get. For that, you can certainly use the courses for a lifting PDO thread course as well. They're fantastic. There are barb threads, which is the top thread here. Theirs is called the Barb Star, and then you've got the 3 bottom threads, which are molded threads, which are even stronger. Generally, all of these threads are about 30% stronger than anything else on the market. What does that mean? Less threads, more lift, rather than many more threads, less lift. That's exactly what it means. Smooth PDO threads we'll do another time. But the 3 top companies really on the market are V-Soft Lift, Nova Threads. Even though you don't see them as much around anymore, but take a look at them for sure. And Mint PDO for that. But here's the equivalency chart. What does this mean? For every 1 V-Soft Lift thread, whether it's a barbed, a molded lifting thread, or it's a smooth PDO thread, I need 3 to 4 Nova threads. I need 4 to 5 of Mint PDO. It's not me telling you that. It's them telling you that, because I've gone through their training. So have some of you. And you're going, this is so many threads. I don't know how many patients can tolerate this for that. Then they come and take an AAFE training. And again, V-Soft doesn't do its own training. The AAFE trains. Why do we use V-Soft Lift? It's the strongest with the least amount of threads for the best result. And that's why we go ahead and use it, because that's how we want to practice. This is supposed to be minimally invasive, not maximally invasive. And again, you can go online and you can see how they teach these things and what they post on social media. I mean, that's around, you can count, that's 15, 20 threads on each side of the face. And by the way, these threads are costing $60, $70. Your cost of threads for a full face is a few $1,000s. What exactly are you charging the patient? And I would contend, and they will tell you when they train you on these threads. Again, I've gone through the training, so have some of you, which has really been frustrating for many of you. They will tell you, well, you need to do the procedure. You need to sedate the patient. Afterwards, they need to be on antibiotics and steroids and narcotics for that. That's not the way we want to do threads. That's not AAFE. That's not V-Soft Lift. This could be Nova or Mint PDO. They've had faculty that have, teach for both companies or have gone between companies, that they pretty much look exactly the same. What does it mean if you need to use these many threads, lifting threads? It means you're not using a very strong thread. That's why you need so many. And some of them even have, these are the regular lifting threads, and then we need fixation threads on top of the regular lifting threads. We don't have that, because when you use the strongest thread, and it's a nice result, for that. But would you rather use 3 to 4 threads on each side of the face or 20 threads on each side of the face? I would venture to say that if you were the patient, you probably would want 3 to 4 rather than 20. So let me show you, again, quick video. It's just more about technique than that. Just give you a taste of what we do and teach in the AAFE with V-Soft Lift thread. So here we go.
Here is a great case of using the minimal amount of PDO threads that you need to accomplish your goal. And we're going to show you this here. First, let's go ahead and map out the patient here. Obviously, skin is going to be very, very well cleaned off here. And then we are going to map this out anatomically. We're going to put this about in the posterior third of the zygoma, right around the zygomatic bone, but we're testing out the tissue. Where do we need to go ahead and get the lift that we want? So this is going to be a great starting point right there, and we are just going to draw straight down to the areas that we want to go ahead and accomplish. And here we are actually going to go past the marionette line past the nasolabial fold so we can go ahead and get the most lift available. There are times when we do not go past the nasolabial fold or the marionette line. It really just depends on the patient, how much lift they need, and what we are trying to accomplish here. So first thing we're going to do is we are going to go ahead and just inject a little bit of lidocaine with a ComfortTox syringe right at that starting point, and that's where we are going to have our pilot hole, and that's going to be with a pilot hole needle in just a little bit. So a little bit, 0.1, 0.2 of lidocaine, make sure it's numb, and now we are going to go in with an 18 gauge pilot hole needle here. We are going to go ahead and use a 19 gauge barbed star 19 by 100 millimeters to go ahead and accomplish this lift here. Now, with this pilot hole, get in there and really go ahead and extend that tissue and really go ahead to make sure that we are going to be able to get in there with our cannulas here. And what we're doing now is we are going to go ahead and do something called pre-tunneling in the AAFE. This is an AAFE exclusive, and this is going to be using a ComfortTox micro cannula that is going to follow along the tracks. Now, this is so important, and we're going to inject a little bit of lidocaine as we go ahead retrograde as we pull that out, and now we're going to turn and go along that second tunnel there as we're creating these micro tunnels with the micro cannula. You want to make sure you're in the right plane. Right here is when you are going to make sure that you are in the right plane, and then go ahead and just track along there. And you are going to have your other non-dominant hand do the work. You are pushing the tissue over the micro cannula. Now we're going to give a thread, if you will, of lidocaine. You don't want to flood the tissue with lidocaine because then the actual PDO thread will not have anything to grab onto. There'll be too much fluid there. Now we're going to go ahead and introduce, this is a V-Soft Lift barbed star 19 gauge by 100 millimeters, and we are going to use that. Why? It's going to be by far the strongest, and that's why we only need 2 threads on this. Now, this is a tricky area when you first go ahead and learn this, is getting around that cheek, getting around the anterior zygoma to get down to that nasolabial fold and past nasolabial fold, which we go ahead and want to do in this case here to really get the most grab and pull everything up and back. So you can see that they've twisted that a little bit. Why did it go in so easily? It went in so easily because this was already microtunneled before with the ComfortTox micro cannula, and now we are placing the second thread and going down to that marionette line. As you can see, we're just twisting it back and forth, but we're using the other hand, curtain over the curtain rod, as it's called in the AAFE, where we are moving the tissue over the cannula. This is the proper way to go ahead and do this. And now we are where we are at, and we can go ahead and just go ahead and now pull that out. And while we pull that out, we are going to extend that lift, as you're going to see, once we determine that we are exactly in the right plane, exactly where we want to be. Extend that lift and pull back and out and up. And that is all done. I mean, it only took 2 of these V-Soft Lift 19 gauge by 100 millimeter barbed threads. They also make molded threads, which are even stronger, but we don't need them in this case. This will do the job just fine. Now, if this was any other thread, you'd be talking about 5, 6 to 10 threads on either side, and we would repeat this procedure on the other side there as well. So that talks to the strength of V-Soft Lift with the AAFE procedures and protocols. That makes for a great lift, the minimal amount of threads for the maximum effect on this patient. And she was noticing her jowling. She was noticing her square face, the bottom of her face, and this is exactly what you want to go ahead and do. If we need another thread or 2, we would put that in as well, but this was perfect for this patient. So you see all kinds of patients. You don't have to wait until the patient's got the hanging jowls that are around their knees to go ahead and pick them up. Clean out that area, smooth everything down, and that goes ahead and have the patient take a look. And that is a gorgeous lift with only 2 PDO threads. And that is really what is amazing. And that really attests to the power and the strength of the barbed threads of V-Self Lift. And again, the molded threads are among the strongest on the market there as well. Now we go with something called ComfortTox Restore, which is going to be something that we use post-procedure, whether it's fractional laser, microneedling, PDO threads, many different uses for ComfortTox Restore. It's anti-bruising, anti-swelling, really anti-inflammatory to really get this patient a really nice result so that they don't have to go hide out for 2-3 weeks for that. And here is the before and after, and you can really see how the square face before turns into a more lifted face. The cheeks are a little bit more prominent on her there as well, and you can really see a beautiful, beautiful before and after on this patient. You should learn to do this too. It's time for you to get AAFE certification trained today.
Okay, so that is it in a nutshell. Obviously, there's a lot more to it, but I just wanted to give you a little taste of what that looks like. Lifting, to us, there are 4 injectables. There is neurotoxin, there's neurotoxin, there is dermal fillers, there is smooth PDO threads for collagen biostimulation, easiest and fastest one, and then there's lifting PDO threads, where you do a case like this. She had only 6 V-Soft threads, 3 on each side. Now, you would look at that before and you would think, holy cow. Now, we always tell them, you might want to consider facelift because there's a lot of other things you can do with a facelift. She did not want to go surgical, and this is a good stepping stone, or this may be all that she needs, because she was really happy with the result here. Your cost of PDO threads was $210. Patient fee, you can charge as low as $1,250. You can charge $1,850, you can charge $3,000. It's really about the outcome for this. Treatment time about 20 minutes. Number of treatments 1. Results lasting 12 to 24 months. So that is pretty much how we look at this. This is also a recurring revenue kind of thing. How can you get trained on PDO threads? 2 ways. You can, first of all, go to aafetraining.com or just buy the package that you had tonight. And it can be one of the lifting PDO threads. We have a level 1, we have a level 2, so you certainly can register for both of those with a 2-course package, or go to vsoftlift.us, because if you go to VSoft Lift, they have PDO thread packages where if you buy, 1 thread package, they will get you into an AAFE regular training, group training. If you buy a big enough package, because it's about time you really want to get into this because you're more advanced injector, you'll take the AAFE course in your office with a private training. So they have got some opportunities there as well. Certainly that's a great way to go if you're committed to really doing lifting PDO threads, because your office, your surroundings, your office is going to be all set up. AAFE trainer, all AAFE training, the on-demand, all of that you're going to have for all of that. So that's how you can do it. Again, I'll stay for final questions. Again, here is the filler emergency protocol. Go to that QR code or aafewebinars.com. Allison, by the way, I tried to register for filler emergency course from the QR code. Not directed to a place to pay for course, just subscribe button. Don't know there. Go to aafewebinars.com, Allison. Click on that, that banner about that, and see if that is if that'll help you get to the right place. I don't know if it's a cookie or one of these fancy terms that I can never figure out. And here are the last call for these aafespecial.com offers tonight. Congratulations to all of you that got it. I think they're pretty close to the packages. That are gone. So if you want the last few, if you email Haley, make sure that she gets you registered, or you register by midnight tonight, or just go straight to aafespecial.com and register there by midnight tonight. And let me just see if there are any final questions here. And I think we did that. I think we pretty much nailed it. Thank you so much, everyone. Wow, I cannot believe what time it is. Thank you for staying on. We had so many of you stay on all the way through. Like 80+% of you stay on all the way through. Thank you so much for staying on. We really do appreciate you spending the time with us. I hope it was good for you. We always welcome welcome your thoughts and comments for all of that. So we hope to see you again. We'll see. It looks like a lot of you in a couple of weeks for 911 filler emergency. But I will show this again. Grab the last packages, last call for that. There is that you can take a picture of this again, but always take a look at afewebinars.com because that's where we'll put the November webinars coming up and everything else. Thanks for the kind comments, everybody. Take care, everybody. Haley, thank you for helping all of these nice people out there as well. Continued success to all of you. We will talk to you all again real soon. Take care, everybody. Thanks for the love. Thanks for the hearts. We